Human metapneumovirus, or HMPV, is a respiratory virus first identified in 2001. It is now recognized as a common cause of respiratory illness worldwide. HMPV affects young children, the elderly, and those with weakened immune systems. Symptoms include runny nose, cough, fever, and wheezing. There is no vaccine or specific antiviral treatment for HMPV. Treatment focuses on relieving symptoms and preventing complications. HMPV is highly contagious and spreads easily from person to person. The virus is primarily spread through respiratory droplets released into the air when an infected person coughs or sneezes. These droplets can travel up to 6 feet and can infect others who inhale them. HMPV can also spread through direct contact with contaminated objects or surfaces. For example, if an infected person touches their nose or mouth and then touches a doorknob, the virus can be transferred to the doorknob. Another person can then become infected by touching the doorknob and then touching their own nose or mouth. Symptoms of HMPV infection typically appear 3 to 6 days after exposure to the virus. The most common symptoms of HMPV infection are similar to those of the common cold, including runny nose, cough, sore throat, fever, and headache. Some people may also experience wheezing, shortness of breath, and difficulty breathing. In most cases, HMPV infection causes mild, cold-like symptoms that resolve on their own within a week or two. However, some people may develop more severe complications, such as bronchiolitis, pneumonia, or croup. Infants, young children, older adults, and people with weakened immune systems are at increased risk for developing severe complications from HMPV infection. HMPV can lead to serious complications in vulnerable populations. Common complications include bronchiolitis and pneumonia, causing wheezing, coughing, and shortness of breath. Individuals with weakened immune systems, infants, and older adults are at higher risk. Asthma and COPD can be exacerbated by HMPV infection. Understanding risks is crucial for prompt diagnosis and treatment. Section 4. The seasonality of HMPV. HMPV exhibits a distinct seasonal pattern, typically circulating during the winter and spring months in temperate climates. The peak season for HMPV infection varies depending on geographical location. In the United States, HMPV activity typically begins in the late fall or early winter and peaks between February and April. The seasonality of HMPV is thought to be influenced by several factors, including environmental conditions and host susceptibility. Like other respiratory viruses, HMPV thrives in cold, dry weather, which may explain its prevalence during the winter months. Reinfection with HMPV is common, and individuals can experience multiple infections throughout their lifetime. While immunity following HMPV infection is not lifelong, subsequent infections are often less severe than the initial infection. The virus can also reinfect individuals despite previous exposure, although the symptoms may be milder. The factors contributing to HMPV reinfection are not fully understood, but they may involve the virus's ability to evade the immune system or the waning of immunity over time. Further research is needed to fully elucidate the mechanisms underlying HMPV reinfection and to develop effective strategies to prevent or mitigate subsequent infections. Section 5. Prevention and treatment. Currently, there is no specific antiviral therapy or vaccine available for HMPV infection. Treatment primarily focuses on supportive care, aiming to alleviate symptoms and prevent complications. Rest, fluids, and over-the-counter medications, such as pain relievers and fever reducers, can help manage symptoms. Preventing the spread of HMPV relies heavily on practicing good hygiene and taking preventive measures, particularly during peak seasons. Frequent hand washing with soap and water for at least 20 seconds is crucial. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used. Covering coughs and sneezes with a tissue or the crook of the elbow, rather than the hands, can help reduce the spread of respiratory droplets. Avoiding close contact with individuals who are sick, especially those exhibiting respiratory symptoms, is also advisable. Maintaining a clean environment by regularly disinfecting frequently touched surfaces, such as doorknobs, light switches, and toys, can further minimize the risk of HMPV transmission. Staying home from work, school, or childcare when sick is essential to prevent spreading the virus to others.